Hi, everyone. Good afternoon. My name is Jo Comerford. I represent the Hampshire Franklin Worcester district in the state Senate, the Massachusetts State Senate. I'm very, very glad to be coming to you live today via Facebook with three really incredible human beings. And we're talking today about vaccines, specifically the COVID-19 vaccine, specifically the rollout in the Commonwealth of Massachusetts. And these folks are on the front line of that work. And I know that many of you have questions. Many of you have shared opinions. All of them are really important as we make it through this global pandemic together. So please join me in welcoming Meredith O'Leary, who's the Director of Public Health in Northampton, the city of Northampton, Phoebe Walker, the Director of Community Services at the Franklin Regional Council of Governments. Phoebe was also on the state's COVID-19 Vaccine Advisory Committee. She'll talk a little bit about that work. And then Tracy Rogers, who's the Emergency Preparedness Program Manager, also at the Franklin County Regional Council of Governments. So welcome to you all.
Thank you.
Thanks for having us,
Senator Comerford.
So happy to have you here. And please call me Jo. So it's a conversation between colleagues. So we're going to get right into it, but for folks who are watching, just to set the context, there's been a lot of vaccine news recently.
Oh, really?
The Commonwealth has launched a 3-phase vaccine plan, and each of our guests, our colleagues, will talk a little bit about that. But there were big news because we're moving into what's called phase 2, specifically adults ages 75 years and above. And this is, of course, a really important cohort of people, a lot of people in the Commonwealth, many in the Hampshire Franklin Worcester district have been tuned in. And at the same time as we move into that phase, there have been shifts in the plan, and there's also been concern about scarcity of the vaccine, actually. And the scarcity piece is something that the state has little say over. This is a federal matter, but it's all colliding together. And it's caused a lot of confusion. On top of that, some of the rollout has drawn some criticism, again, which we'll talk a little bit about today. So for those of you who are listening, we're going to put comments in the chat, put some useful links. You can certainly ask questions or make statements. We'll try to incorporate them. We've come with a list of questions to discuss based on each of our constituent feedback. And so we'll launch in. So Phoebe, I'm actually going to toss to you, if I can, and ask you two questions related. Could you just open with a synopsis of how the state came to make the vaccine plan that we have? And then if you could just talk to us about the quantity of vaccine in the state currently.
Sure. So the state has a statewide vaccine advisory group on which I sit with about 17 other people, most of them epidemiologists or doctors. And we had about 3 months of meetings to come up with the order in which these phases were ordered. So when you look at phase 1, you will see the COVID-facing healthcare workers, and then it goes on from there. And we made significantly different from other states, one with a lot of separate slices, because we were trying very hard to look at who is dying, how can we prevent death in our state, and how can we ensure that equity is a guiding principle. So there are many states in which home health workers, prisoners were not in any way elevated in the phases like they were here in Massachusetts. So basically they brought this group of people together. We debated all kinds of different things. We looked at many different models from different states. We took a lot of guidance from good thinking people across the country, and then we came up with this set of phases. So we're now, as you said, just beginning phase 2. I think it's important for people to know that phase 1, we're only about 65% through phase 1, which was 750,000 people. So there are a lot of people in phase 2, but just for context, there's about 86,000 doses of vaccine that come to Massachusetts each week. There are 7 million of us in Massachusetts, and everybody in that first phase needs 2 vaccinations. So you can see that it's a challenging math. But so right now, the state has gotten somewhere between 600 and 700,000 doses in total of the vaccines that it will need to vaccinate everybody. Maybe one other thing to say about that is just that once the one-shot vaccines become available, sort of the math changes significantly because we're not having to give every person 2 vaccines.
Okay.
So, Joe, I'd also like to add that Mass Department of Public Health every single week updates their vaccination website, which tells you how many vaccines they've given to date, how many second doses they've given to date, and it actually breaks it down. It'll give you the total, but it breaks it down by county too. So it has some really good information, and it also has a nice graph depicting by day how many vaccines were given. So it's very interesting to look at that. And it's updated on Thursdays at 5 o'clock.
Absolutely. Thank you so much, Meredith. And really cheers, frankly, for the folks at DPH trying to do this work. The dashboard and actually the COVID dashboard writ large, you know, the big testing dashboard. These are attempts at real transparency and accountability on the part of the state. And I know that DPH hopes to combine these 2 dashboards so that we can see the biggest picture possible, the vaccine and the testing together, because that's, of course, the sort of 1-2 punch that we need to make it through the pandemic. So Phoebe, building, and Meredith, building on what you were just saying, could one of you walk us through in a little bit more detail the phases as they stand now? So we heard from Phoebe that we're going into phase 2. We've 65% completed phase 1. If you could tell us, and that's in part because we have to give the second vaccine, but if you could just tell us who was involved in phase 1, and then who's going to be involved in phase 2.
Sure. Phoebe, do you want me to take this one? Okay, I'll do my best and you can fill in the blanks. So phase 1 was first responders, dispatch, healthcare workers, PCP, long-term healthcare facilities, those who participated in vaccination clinics, testing sites, congregate care, COVID facing and non-COVID facing healthcare workers. And we had phase 1 as an overarching umbrella, and then each one of these items, priority groups, were bulleted underneath. And in the beginning, they opened it up by bullet and they would just go down. Then I believe on the 21st of January or thereabouts, they flattened the phase. So anyone who fell under phase 1 was then allowed to receive the vaccine, which was fantastic because it made it a lot easier on our end who were actually giving the vaccine, because verification process was very, very challenging and time consuming at the vaccination sites and during registration. Phase 2 is to begin Monday, which is February 1st, and only the first bullet of phase 2 are going to be eligible. And those are anyone who are 75 or older can get a vaccine starting the 1st under phase 2. Other bullets in phase 2, the second bullet is those who are 65 and older, and still under the second bullet, those individuals who have 2 comorbidities, and there's a whole list of what those comorbidities are, and they're diabetes, COPD, heart conditions, cancer, a whole bunch of things fall under that. People who live in residential living and staff, and low income and affordable housing for seniors. So that's the second bullet. That's not opened up yet. What happened was the 65 and older were at the bottom of phase 2 originally, and they got pushed up to the second bullet. And then underneath that, we kind of have an other category in phase 2, and that's K through 12, early education, grocery store employees, utility, public works, public health, anyone in retail. It's pretty exhaustive. And again, you can actually get this information on mass.gov. And then phase 3 is the last phase in the vaccine rollout plan in the state. And it's bulleted higher education, beverage industry, veterinarians, and then everyone else falls under that. They've kind of earmarked timelines for these phase rollouts, and February is supposed to start phase 2, which they're right on track. And then phase 3, I believe they said around April, Phoebe, is that correct?
Yeah.
Okay.
Thank you so much.
So
I just want to bookmark. Yes, yes. Just in a second. I just want to bookmark that we're going to talk a little bit later about comorbidities
Okay.
and attestation, because there's just a ton of questions coming in. So was that going to be what you offered, Phoebe? Okay, so let's just bookmark that. So if you're listening right now and you want to understand, if I'm a teacher, what kind of information will I have to bring?
Right.
How will I tell people that I have two comorbidities? How am I going to do that? Hang on to those questions, because we've put them down for you. So thank you so much, Meredith. Let's now, still at this sort of 35,000 foot, let's talk about really specifically to Hampshire and Franklin counties. I want to understand, if I'm in Hampshire and Franklin counties, what do I do right now? Where do I call? And perhaps Tracy, you want to start with that, or anyone, but I just want to say that you may have seen, friends who are watching, that Senate and House members and I yesterday really raised our voices, because as we pivoted to this cohort, this age 75 and above cohort, and as the decision, as Meredith said rightly, was made to advance the 65 and older cohort. At the same time, the governor also made decisions to open some larger sites, mostly in the eastern part of the state. And those decisions, coupled with a vaccine scarcity still, led us in Western Massachusetts, I believe, especially in Hampshire and Franklin counties, to just not have our fair share for two counties. And that was deeply unfortunate. We're on the road, thanks to the folks on this Zoom and so many others who raised their voices. We're on the road to regain some ground, but that's real. And I just want you to know that everybody tuned into that. Everybody worked together, House and Senate members, municipal workers, certainly public health and emergency management frontline. So what we're talking about now as we go into this, so where do I get a vaccine? We're talking about it through a lens of making some gains to get more vaccine back in Western Mass, but not having enough yet. And I'm not convinced that we have our fair share. I don't think anybody is yet, but we'll keep pushing for that. But let's talk about sort of the optimal way in which people would start to get a sense of where the heck they'd go to get vaccines if they're living in Hampshire and Franklin County. Tracy, can I punt to you?
Sure, I can talk about Franklin County. And Phoebe, pipe in if I miss something or get something wrong. We have primary care offices starting to offer. So Valley Medical Group, Community Health Center of Franklin County on Monday will begin vaccinating those eligible. Bay State Franklin Medical Center at the end of February for patients who belong to their service. And then at the Council of Governments, we are working with all of our local boards of health to set up public clinics as well. Because at the moment, we're restricted to 100 doses per vaccine provider per week for the month of February, to put a little crimp in our planning, we are pooling our resources in Franklin County and shipping those vaccines to Greenfield, where they have been operating a clinic for first responders at the John Zahn Community Center. That's going to, still working out the details with them, but that is going to transition into a phase 2 clinic for those 75 and older, and then 65 and older, et cetera. Using the vaccine from other parts of the county, everyone will be allowed to go there no matter where you live in Franklin County. Hopefully the pipeline opens up a little bit in March, and then we will have that center open in Greenfield, as well as some smaller sites. So we are working at some location in Deerfield, perhaps Frontier, a location in Shelburne. We're going to look at both Mohawk High School and a Shelburne Community Center tomorrow to see which of those is better. And perhaps Kringle Candle in Bernardston. Those are all spaces that are large enough to have people socially distanced, particularly since they have to wait around 15 to 30 minutes after they have their vaccine to make sure they don't have an adverse reaction. So we need a lot of space for people to sit for 15 to 30 minutes. And then starting phase 3, which we hope will start in April, we are looking toward planning large drive-through clinics. So people will be able to stay in their cars, as we've done for many of our flu clinics. We will have tents to hopefully keep the vaccinators warm so their hands won't be shaking. And that will be the general public who's finally able to get the vaccine, hopefully in April. So we have just set up a hotline this morning. If people want that information, anything we have at the moment, as up to date as we can keep it, that's 413-774-3167, extension 153. We also have a very bare bones page on the FERCOG's website at the moment, www.frcog.org, that we are working on getting much more beefed up, so information will be there. We are also working to, starting tomorrow, get a weekly situation report out to all of our stakeholders, our boards of selectmen, boards of health, emergency management directors, police, fire, town administrators, you name it, so that we can keep them up to date and they can keep their residents up to date on what we're doing. So I think I will stop there. That's what we're doing in Franklin County.
I would only add two things.
Adam.
One is that one of the only places right now you can get vaccinated in Franklin County is also the CVS in Greenfield, which has 144 shots a day available, and is the cause I know of a lot of consternation among people is the design of the CVS website, because when you go there, if there are no shots, it doesn't tell you come back at X o'clock. It just says no vaccines available near you. So I did speak with CVS corporate today and ask them, and they did say they would look at redesigning the page because it's been so deeply frustrating to people in Western Mass that they can't even tell. But I just want people listening to know they do have 144 a day, and every day, the 7th day becomes available. I don't know what time, but I do know that. And we're also working really hard with LifePath and the Councils on Aging to start looking at the people who won't be able to make it to our regional or spoke sites, how to get to them at home. And there's a lot of creative thinking going in there about the difficulty of this vaccine and how to get it there. And then finally, I just want to shout out to the sheriff, who is also a vaccine provider because of the residents there and the staff. And so they are also part of our planning to look at how they can add capacity with their vaccine, and are stepping up in a great way.
So I just want to say that this overview, I hope, is inspiring quite a lot of relief, I would imagine, because the kind of texture that you're bringing is just the sort of breaking news of what's happening in Franklin County, because you're right, Phoebe, up until now, really, the public facing vaccine site in Franklin County has been the CVS. And we also paid the same call to the CVS, good folks at CVS, and said, oh, this isn't working. So thank you for that advocacy. So it's exciting, and we'll be excited for folks who are tuning in, Tracy and Phoebe have given you places to go on FERCOG's site, but certainly our team will feel responsible to get this information out to you as well, and we'll work with FERCOG to make sure that the Franklin County plan is understood. That we'll do our very, very small part there. So let's pivot south to Hampshire County. Meredith, if you could talk specifically about Northampton's clinic, which is so important, and then we can talk more broadly about what's known currently in the region.
Okay. Well, I think it's important that everybody knows that, mass.gov/COVID vaccine map shows you all the locations on who's doing vaccination, whether it's a mass vaccination site, local health department, retail, so on and so forth. But here in Hampshire County, the week of January 11th, Amherst and Northampton agreed to stand up 2 vaccination clinics to cover all of Hampshire County constituents and those who worked in Hampshire County. So I think it's important that everybody knows that, Sorry?
I think there was just a little back. Please keep going. I think there was a little bit.
Sorry about that. Okay. So if you go to northamptonma.gov, that's where you can register for to get on a wait list for the City of Northampton vaccination site. And what happens is we've been playing with this website for the past week and kind of troubleshooting it. We're building the ship as we sail it, I'd like to say, because we get a lot of feedback, a lot of phone calls, and a lot of emails. It's very clunky. So we've been working really, really hard to figure that out. We have it broken down. If you fall under phase 1, click here to register. If you fall under phase 2, 75 and above, click here, get on a wait list. Phase 2, 65, by bullet points, click here. So we've made it really foolproof, very, very easy. We also learned we're aware of that not everyone has access, especially in our hill towns. So we have a telephone number, 413-587-1219, that anyone can call. It's manned every single day by a human being, and it's so busy. Unfortunately, a lot of calls are going to voicemail, and we've had to actually ask our IT department to open up how many calls it can hold in the voicemail. That line is extremely busy. We're hoping to get back to everyone within 72 hours. So for the city of Northampton, we did the first week, we did the first responders vaccines, and we did just about 700 vaccines. Amherst did about the same. So in Hampshire County, that's 1,400. We knew that we wanted to commit to support the state vaccination efforts all the way through to the end of phase 3. Our intentions were to kind of ramp up slowly until we got our footing and all the kinks were worked out. But we were expecting, if vaccine was available, that the Northampton vaccination site could vaccinate 3,000 people a week, and the the town of Amherst could do 2,500 a week. So that would be 5,500 vaccinations in 1 week in Hampshire County with these 2 sites. That's more vaccines than Gillette Stadium is doing, and that's a mass vaccination site. So please advocate for local health departments that are standing up clinics to get the vaccines. We have the capacity. It's unfortunate right now that the state, is very limited on what they have for vaccines overall. They do tell us they are not sitting on any vaccines. What they have, they are giving out. And I think it's about 80,000 a week that they're getting from the federal government. The unfortunate part, only 5,000 of those doses are going to local health department clinics that are stood up. That's a real small percentage in the overall. And I think there's about 130 or so local health departments that have stood up clinics and want to support the efforts through. So that's not a lot of vaccines.
And I'm just going to say, Meredith, I just want to interject a second. I totally agree with you. And I think the situation with regard to that cap came in just as all these things were colliding. We had the push to 65. We had the opening up of some big sites in Eastern Mass, mostly Eastern Mass, and then we capped local public health. And again, for folks watching, and I see some comments coming in, for folks watching, what that meant, and I don't think it was certainly intentional, but it meant that overnight we had such a constriction of available vaccine in Western Massachusetts that we had to make a little noise, as Western Mass can, and we have to continue to bump out the supply available to places like the city of Northampton and the town of Amherst and the Franklin County towns, because we're a different region than the big Gillette Stadium sites. We need to reach our people where they are. We need to go to them in these rural areas without adequate public transportation. So in addition to wanting big sites for folks who can get to them, we want that too. We want our local public health to have the respect and resources they need and deserve to be able to do the work of phase 2 and phase 3. Phoebe, I see that you want to jump in, but I interrupted Meredith. Do you want to?
I do. I want to give Amherst information.
I'll go back to Phoebe afterwards.
So to register for Northampton, it's the northamptonma.gov. There is a big vaccine clinic tab that you hit, and it gets you to all of those links, or the telephone number I gave you. For Amherst, the phone number they too have a hotline is 413-259-2425, or you can go to amherstcovid19.org for registration information.
And just for folks watching, I put a link to a page that my team put together for the resources that are known currently. So these numbers that Meredith and Phoebe and Tracy are saying are in the chat right now, and we'll make sure they accompany this video. So please go ahead. I'm sorry, Meredith.
No, absolutely. So I just wanted to add that we are working with our councils on aging. We're talking about point of dispensing sites, going to the people where they're at. I think one thing that's really important that I've been in public health for 18 years now. The eastern side of the state doesn't really understand the culture and the geography out here, the large swath of land that we have. And for people out in the hill towns to get to Gillette Stadium or even the Eastfield Mall in Hampton County is just not, it's not doable for them. So they really rely on local health to be able to support, you know, whatever their needs are. So thank you, Joe.
No, thank you. My goodness. Thank you. And thank you for putting in details about Amherst, another critical site in Hampshire County. I would just throw in UMass, so the University of Massachusetts Amherst. God bless them for their testing. It's like a precision outfit there. If you haven't been tested, it's free. The state is paying for these things. They also set up a vaccine clinic. They are running right now at about 840 per day. They will, beginning next week. Again, this is, this is news, and we're going to have to see how this goes, but they will also be increasing. They want to step up. They want to do their part in Hampshire County as well. So Phoebe, jump in, and then I'll go to the next question.
I just wanted to clarify that in terms of the doses, so there's 86,000 coming in per week, and of those, 10,000 Pfizer and 5,000 Moderna are the cap for local health. Just so it's more, but I don't think we probably want to get too much into the details around Pfizer, but it's a very different bear in terms of managing it. It comes in chunks of 975. It has to be treated very differently. So just wanted to make sure people knew it was a little bit more.
No, that's helpful. That's helpful. And I, again, kudos to Northampton and Amherst for being able to take this more difficult vaccine because you're doing it so that we can have more in the Commonwealth, and so or in Western Massachusetts. So thank you. I'm going to go to I'm going to drill down just a little bit more now. I want to talk about how people, to the extent that you know it currently, how will people know if it's their turn to get vaccinated? So you've rolled out the plan, you've told us about the plan, but if I'm watching, if I happen to catch this, how do I know if I'm, in sub-bullet 4 on phase 2? How will I know that it's going to be my turn and I can sign up?
State does have a nice visual that shows each sub-phase and each week of each month, and it shows you when they're supposed to come online. So again, at that, basically you can just type in anywhere, mass.gov COVID-19, and you'll get there. And so there's that. A lot of, obviously, anybody who's associated with a particular group, that group is generally communicating to them, dentists, food pantry folks. But another thing is that almost every primary care practice has gone into their medical record and looked at everybody over 75 and then everybody over 65 and sort of stratified them by risk, and everybody with 2 or more of these conditions that make you extremely at risk of negative impact from COVID. And they are going to reach out and say, hi, it's Valley Medical Group. It's your turn. Click here to sign up. So that's the plan in terms of medical wise. Otherwise, I think the announcements from the governor and the command center and that image are the most useful ways.
That's helpful. And I will say, in addition to the site, you can go onto the site, and there is if you're a text message kind of person, you can sign up for regular text messages from the state. That's just another way that the state's putting this into play. Okay, let's pivot now even more granularly. And I want to understand what the state means when the state talks about comorbidities. I want to understand, and attestation. Could we go there, you guys? It's a very big deal for folks. And we're going to, right after 75 and above, we're going to have this cohort of people who are higher risk, and they want to understand what they do when it's their turn.
So I can speak to the comorbidities, and maybe someone else wants to talk about the attestation form. But the one thing I know is really confusing to people is that the state website, at least up until yesterday, I don't know if it's changed today, because we did discuss it in our advisory group, says sends you to a link of the CDC's, which defines the comorbidities, right? And for people listening, comorbidities just means 2 other conditions that you might have. And those, that unfortunately, that link at the CDC site has 2 lists on it. And it isn't clear to people that it's the first list, not the second one, that qualifies you. So that, I think, is because the states, when the advisory group met and took a vote on which of these lists to do, we didn't want to put baked into the Massachusetts website a list, because if the CDC moves things from these things might make you more at risk to, oh, we understand now that these things make you at much more risk, if they move things between that line, we want people to find it when they click on the list. But it is deeply concerning to many people that you follow a link on the state website and then you see 2 lists, and one of them might have something on it that you have, and that makes you feel very vulnerable. But you can't tell if that's the list that Massachusetts is saying. So it's the first of those CDC lists.
Okay.
Who wants to talk about attestation?
Yeah,
Meredith, you got more.
Yeah, let's talk about attestation. Who wants to go? What does attestation mean? Like, is this the proof that folks, there's a lot of questions coming in. You know, how do I prove that it's my turn?
Yes, attestation means you are attesting to something. You are swearing that you're telling the truth. So there is a form on the state's website that you can attest to being over 65, having the 2 comorbidities, whatever it is, when we get to that layer. They will not be asking for ID. Undocumented folks will not be turned away, but bring that form with you, and that will prove that you are eligible.
Okay, Tracy, I just want to lean in to what you just said. No one is being turned away. No one.
Yeah.
No, I don't think that's probably accurate. The point is that, well, actually, neither of us is running a clinic right now. Why don't we let Meredith answer that question?
Yeah. Regardless of immigration status is not something that's going to turn you away.
That is absolutely true. Right. You don't need government ID to do this. You don't need to prove you are a citizen or anything like that to get the vaccine. You don't even need to be from Massachusetts.
Mm-hmm.
So I don't want to speak for the clinics that are happening elsewhere. I do know you need to have that attestation form, bring it with you. It's an honor system. We know there are going to be people that are trying to game the system. There's nothing we can do about that. In Northampton, we had created our own type of system that once you click on the link and you register, you actually are doing an electronic signature, and it says, you know, under the pains and penalty of perjury, to the best of my knowledge, I fit under this phase, you know, priority group number 1. So there is a little room there where people thought they did, and they've come to their clinic and they just didn't understand properly. We didn't necessarily turn them away, but if it was very clearly they did not fall under that phase and that eligibility group, we did have to say, we're sorry, you cannot get your vaccination at this time. So we have had to turn people away at that clinic. And, you know, we've been faulted for, well, your system allowed me to register, so you should vaccinate me. This is, you know, it saddens us. We want to put vaccine in everybody's arms, Jo, you know, and to turn someone away who is 60 years old because they're not fitting the criteria is heartbreaking. It's heartbreaking to them. It's heartbreaking to us. People are scared and anxious. We're doing the best we can, but we really want to make sure that we are following the rollout plan, you know, that's provided us from DPH to the best of our ability. And if we start letting people jump the line, it's just going to be mayhem. And, you know, it's very important, especially for Amherst and I and UMass, to be on the same page, because there's nothing worse than hearing, well, Amherst allowed a dentist group in, why aren't you letting us? So, you know, if we have uniform messaging, at least in Hampshire County, and we're all trying to be on the same page to the best of our ability for continuity and fidelity reasons, that's the best that we can do.
No, this is so important. So I made a big statement earlier. I'm going to walk that back. What I meant to say is that when the plan is being followed,
Mhm.
and I know that all of you are beholden to follow the state plan. When the plan is being followed, folks who come who are in the right phase. So, for example, beginning Monday, folks age 75 and above, regardless of immigration status, this is a free vaccine. You go, you sign up, you self-attest. It's an honor system, and you move forward. Then we'll get to this issue of 2 comorbidities and age 65 plus. You will go, you will sign up, you will self-attest. One thing that's really important for folks who are watching, and I know that you all know this better than I do, is that currently in the state, there is no uniform portal for signing up. So you can't go one place and put in 01060 and get, the vaccine sites within 20 miles from you or 10 miles, and then have the same user experience moving through the forms. That's a big deal. I just want to honor it. So just 1 second. It's a big deal. And people get confused, and they're on one site and they need one kind of form, and they're on another site and they're using slightly different language. I would say that's what the Senate office is for, in part, right? We're helping people understand this. All of these folks on the call or on the webinar today, the Zoom, are helping people understand it. The councils on aging, the advocates, as we all ramp up, we'll help decipher this. At the same time, as I believe the state has to take some responsibility to create a more user-friendly portal, so that it's more accessible, and we need phone options, and we need multilingual options, and all of that kind of work will help break down these barriers to access. Phoebe.
2 quick things. One, an interesting snag that people may be experiencing if you actually do want to drive to Gillette Stadium, which is a long way from your district, but there could be people who are urgent to go there and can get there, is that when you register for that site and you register from far away, it will automatically try to redirect you to a closer site to you. So that can get a little confusing. I just want to flag that for if anybody's doing a road trip to Gillette to get vaccinated. And the other was just to say, thanks for mentioning the thing about councils on aging. I know that in the next day or two, the Life Path will be coming out with a phone number where anybody without access to a computer or email, or even just has that but can't really make these registration systems work for them, can call in the Life Path service area, and they can get shunted to a volunteer who will do that for them and make sure they get registered, whether it's at their doctor's office or Northampton or wherever it is that they're trying to get vaccinated. So those people are doing a great job putting that together.
That is unbelievable. And I would say, yes, many flowers should bloom. And my hope is that the state makes it easier, so that we have one comprehensive way that people can do this. But in absent that, this is what we need to do to help neighbors access this vaccine. Okay, I'm mindful of your time. I'm gonna pivot now to talk actually about the vaccine itself. Is this vaccine safe? What have you heard? Is it effective? How is it working relative to the variants that we hear a lot about that cause some concern?
I don't know how qualified anybody here feels to speak to that. I can tell you that on the advisory group, the state advisory group that I'm on, there is a group of people who formed a Massachusetts vaccine efficacy working group. And every time a vaccine comes out for gets an emergency use authorization at the federal level, this Massachusetts group of the infectious disease specialists from every hospital system get together and they look at all the data that is associated with that vaccine, and they say whether they feel like it's safe for Massachusetts. This is an independent group from the Department of Public Health. So they weigh in and they say, this one is good for pregnant people up till then, or this one is good for, in terms of these allergies you might have. So they really drill down and say what's safe for Massachusetts, and they put out a memo, which is on the state's website as well. So what I'm hearing from the people around that table is that these are highly effective, highly safe vaccines. And even the ones that are coming behind, are looking very good too. All of these are dramatically more effective than a flu vaccine normally is in terms of percent effectiveness, so these are these are vaccines people can feel really good about taking.
So if I can add a little bit too, prior to the FDA emergency authorization use, both Pfizer and Moderna underwent some vigorous clinical trials, and both demonstrated excellent efficacy against the virus that causes COVID-19, and they demonstrated to be safe as well. Following approval, the vaccine is still being assessed for efficacy. So far, vaccination has proven to be beneficial in both preventing people from catching the virus and also preventing severe illness. And again, it is new, and it's also it's always being evaluated. The CDC continues to monitor for side effects or harmful effects, So once you receive the vaccine, there is something called V-Safe that you can log in your side effects to, and you can do it either on a daily basis or a weekly basis. It's a very simple form to use. And also, healthcare providers are required to report to the Vaccine Adverse Effects Reporting System any side effects or adverse effects that their patients are reporting to them. Mild side effects, we're seeing them happen, our small populations that we've been vaccinating. The most common side effect that we're seeing is a little soreness or swelling around the vaccination point. Some people have mild flu-like symptoms, so body aches, headaches, some chills perhaps, and some fatigue. So we're seeing that, but not very common. And again, if you are having side effects, we're asking that you do report them. There have been, and I think the CDC actually put out a report the other day, but a more severe side effect of the vaccination is a severe allergic reaction and anaphylactic reaction. And I think they said out of some crazy amount of vaccines given, they've only been reported 10 anaphylactic reactions. But it can happen. But what's really important to know about that is we are ready at the clinic to respond to those types of reactions. We have set up our clinics accordingly. We have the medications there, and a lot of clinics actually have an ambulance on site. So we're ready for that just in case it does happen. And after you do receive your vaccine, you're monitored by 5 people at a time, and our clinics are monitored by 1 person for 15 minutes. And if the person had had any type of allergic reaction prior to anything food, environmental, and that was screened accordingly, they have to sit for an extra 15 minutes, so a total of 30 minutes to be monitored. So we're taking this very seriously.
Really important. Thank you so much. There's been a lot of questions in the chat. I just want to pause before we close. I just wonder if someone could go into much more granular detail in phase 2, that bullet of the essential workforce. So teachers and daycare providers and things. So there's lots of questions about, is the list the priority order? Are things moving around in that list? Like, is this how it's going to go? Just like we're seeing these phases open up. Okay, go ahead, Phoebe.
That bullet, that entire bullet, other workers, I have not, well, here's what I can say. Nobody has at this point talked about those sub bullets as being in order. So it has, that would be a big change, and one that has, but big changes have been made. So again, it could happen, but right now, as soon as we move, we use these letters to talk about these, right? So 2A is the individuals over 75, then you got 2B. 2C is a whole category all by itself, and it would be open to everybody in that category at the same time, unless there were a decision made to change that. But right now, that is not the plan. Once you hit that, it will be anybody in that group.
Okay, thank you. And I just want to acknowledge there's lots of comments coming in from educators especially, and people who support educators, just about the bind of folks going back into the classroom. I want to honor that. And I know that educators have been a strong advocate. Families who care about them have been strong advocates in this bucket. I also want to just recognize there was a question about will there be a medical site in Hampshire County for those with allergies? And I just want to go back to what Meredith said so well, that these clinics are being set up to monitor folks who have the vaccine. So it's not necessarily one medical site, as I hear you saying, Meredith. It's people are mindful of a protocol of administering the vaccine that will include monitoring. Is that correct?
Yes, and at our sites, we actually have medical staff obviously administering the vaccine, and we also have a second medical staff in the room doing the monitoring. So it's very safe.
Okay. I'm mindful that I've kept you now for 50 minutes. I just want to go to two more questions if I can. One is, if you could just think with us about what we have to do right now as a state, and I know you're doing this as a region, so maybe think region and state. What do we need to do if you could expand on accessibility? What are you thinking about as you think in Franklin County and Hampshire County about reaching communities of people who are hard to reach? Either they don't have internet access, they don't have internet, which we know in Western Massachusetts is true. English may not be their first language. They may be perhaps elderly and living alone. They may be working, 3 jobs, and for employers, where they don't get paid to have time off. How are you thinking about breaking down those barriers, and what can the state do to help you? What should the state be doing? That's the first question. Tracy, we'll go with you.
As you're talking about internet access, and also for people who aren't even comfortable with using a computer, that is definitely something we're all concerned with. And as Meredith said, she has a hotline for people who need help registering. We're working with LifePath to set up the same thing, so someone can help you register over the phone. If there was, on the statewide website, you can click a wonderful map to see where you could go. There should be a phone number there that people can call and register at the state level. It would definitely relieve the burden on the local boards of health trying to field those phone calls.
Wonderful.
And in terms of those with different languages and different cultures, we're aware that there's a big Moldovan community in Franklin County. And typically that culture does not trust government. So it's going to be hard for us to convince them to listen to our messages and to come get vaccinated. So we are working at other avenues, people they trust, to get the message to them that they should come to our clinics.
So in Hampshire County, we're partnering with Healthcare for the Homeless. We do have a large homeless population, unsheltered, those who, choose rough sleeping. So we are providing them vaccine and access into our software program to actually go where the people are at. We're discussing, again, point of dispensing sites. One of the problems is the vaccine is extremely fragile. We're told, transport once and that's it. So we're trying to figure out the logistics of, reaching people where they're at. We're working with the Council on Aging and the Center for New Americans. So we're doing the best that we can to, to make sure that we're being culturally sensitive, that we're reaching the underserved populations, and we are open, for suggestions. So if anybody who's listening has any type of guidance or recommendations for us, please feel free to give me a call.
Thank you so much. Phoebe, do you have anything to add?
To the broad question of what could the state do to increase access?
Yeah, or anything else in terms of what's happening in Franklin County, which thank you, Tracy, and Franklin County and Hampshire County. Thank you, Tracy and Meredith, for just opening up a window. I know there's much more detail, but it's really, I think, exceedingly important for folks to hear that there are people on the ground thinking through these methodical steps of how to reach communities, because it's the right thing to do in the middle of a pandemic, but it's also, you're trying to do that. I forget who said it, but, build the runway, fly the plane, build the plane, stock the plane, all at the same time. And I really appreciate it. You're taking on greater complexity to reach more people. So go ahead, Phoebe.
I think the only thing I would add is just that 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 this is going to be, like many things in health, sort of a haves and have-nots experience, and that it's local public health's job to really work hard to make sure that that doesn't happen. And so I think when we get more vaccine, which would be really great, it was very upsetting to have the vaccine supply so tightly constrained after weeks of planning to do this work. It's going to be really incumbent on local health departments to find those people that are hard to find and do that extra work, and let the people who can drive to UMass or the Eastfield Mall do that, and make sure we're doing this hard. Like as Meredith said, transporting this stuff is very hard, and you can only open a vial and keep it open for 6 hours. So just that alone in the hill towns, trying to get to multiple single shut-ins, and have them be watched, but have the vaccine keep moving to someone's house. It's a very complicated project, but I think that that's the beauty of Western Mass. We have these relationships, we have these connections, we know our communities, we will figure this out. But it is going to be slow. And I think that's very hard for people to hear, but it's coming. People are planning for it, but it's going to be slow to get to everybody.
Thank you. And in the last couple of minutes, before I gush over you again and invite people who didn't get their question answered to just write me, and Cameron from our team will put our email in and we'll answer every question we get. That's what we do. Let's talk just about local public health. There is a bill, I'll just say, coming in. It's State Action for Local Public Health Excellence. It invites Massachusetts to reinvest in the essential public health infrastructure in our Commonwealth in a way that we just have never done, frankly. And I wish, if you could just talk a little bit, each of you, about what local public health does. So you're leading now the vaccine distribution with good partners like UMass Amherst and others who will lead it. But why invest in local public health?
We're the invisible line of protection, and nobody knows about us until they actually need us. Local public health has been underfunded historically. People don't really understand what it is that we do. I remember about 15 years ago doing just this non-scientific survey asking, it was a small group, 200 people, what they think public health was. And they're like, it's the people who clean the streets, or they just really didn't know. So we do a lot. We, from inspections to, sanitation to water to you name it, we do it behind the scenes. We're that line of protection that keep people safe from going to public places, essentially. We have 351 communities here in Massachusetts, and we have 351 boards of health. We don't have 351 health departments. Many boards of health are volunteer members that don't even have any type of public health background, making decisions that are best for their community. So what that lends to in Massachusetts is having, we don't have uniform policies, we don't have uniform regulations from one community to another. We have seen this a lot over time, like say tobacco, for instance. One community, Northampton, would increase the minimum legal selling age to 21, but in East Hampton, 2 miles down the road, you could buy it at the age of 18. So we don't have uniform policies, which makes it a struggle. Having more district health or county health is really important. And I think that's something to strive for. And I think that's something that, after we get on the other side of this pandemic, that we need to be focusing on, because it makes for a stronger workforce. Health department will have professionals that can cover not only the larger cities, but the smaller communities that don't have the public health infrastructure. We'll have economies of scale when it comes to purchasing supplies for response. We'll have consistent messaging, consistent enforcement, consistency across the board. It's so important that we start funding local health for reasons that people have learned over the last 11 months. We have been in charge of enforcing governor's orders, standing up testing, vaccination. It's endless. So
contact tracing.
Contact tracing.
Don't forget contact tracing.
That one.
Just meeting with the nurses an hour ago.
I'll give you a prime example, Joe, of something that we had to do here in Hampshire County. very early on, the end of March, early April, I realized, Northampton is one of the larger communities in Hampshire County. I realized that contact tracing was not getting done in the smaller hill towns, and it ended up falling in our lap, trickling in our lap one way or another, directly, indirectly, because people worked in Northampton but lived in one of the hill towns. So I immediately put together a collaborative to cover 13 communities and do all the contact tracing for them. I hired 11 nurses to cover 13 communities. It was daunting, but that's the type of infrastructure that needs to be in place, funded and in place to respond to something like this happening. In public health, it was never if a pandemic was going to hit, it was always when. And, we didn't have buy-in for that. And here these smaller communities were left just kind of helpless in what they were going to do. So I'm thankful for all of the larger health departments and the FERCOGs that were able to support these communities and getting them up to where they needed to be in terms of contact tracing and just helping out.
Wow, Meredith, you have to come to Boston. You have to testify when we
Thanks,
have.
I got nothing to add.
We've recorded it, so now, but just so folks know, what Meredith was just saying is embodied in a bill. The aspects that Meredith was saying, having standards of care, having funding from the state to meet those standards of care, sharing resources and regionalization, actually combining data, as Meredith was saying, someone might get exposed to COVID here, but live in Goshen. So the virus doesn't know there's a town border. So Meredith and others have had to cross town borders and have had just a heck of a time with the data management piece of that. So that's embodied in a bill. I want to just tip my hat to Phoebe Walker, who's been the agent, I will say, from my loyal constituent perspective, one of the agents driving this along with the Mass Public Health Association and others. But Phoebe's been calling us to action at the state level. Honestly, it speaks, Tracy, Meredith, Phoebe, the kind of work you're doing right now at the vaccine rollout just is yet one more reason for us to bring to Boston and say, the work that these folks are doing, if we had invested in them now or before, if we really had invested in a local public health infrastructure, what we're experiencing in Western Mass right now would just be different. I'm not saying there wouldn't be struggle.
Totally would. Yeah.
I'm not saying there wouldn't be struggle. So I'm not saying that, folks who are listening, we are dependent on the federal level, but a robust, well-funded, well-resourced, with enough people, infrastructure in our region and across the Commonwealth would have made this vaccine rollout a different experience. As each of you have said, this is what you're made for. This is what you train to do. This is why we have and invest in and need and celebrate local public health. So
we're so lucky to have you leading that charge in the State House. So thank you with your great colleagues.
Yeah, I have two,
Really
Chair Garlick and Representative Hannah Kane. They're sort of a badass team in the House, and so it is just nothing but an honor to hear about your work today, you guys, to do the work with you. The budget's coming up, so those of you who care about local public health, we need money in that budget. There's 10 million, that's not enough. So we're going to go for more. We've got to pass this bill. And then if you've watched today, spread the word. There is information. It does change. We will help you stay up to date. Northampton, FERCOG, Amherst, UMass, and the other sites that are coming online. We will help you stay up to date. It's tricky. And we will be advocating for regional equity when it comes to enough vaccine coming into our region and enough resources to get it done. And we're just going to we're going to get through this together like we do in Western Massachusetts. So closing words, friends, before we say goodbye.
I would just say thank you so much for giving us an opportunity to come, and we're fortunate to have you, and this is very, very hard, and we are all going to get through it together. And I think that there are a lot of hard conversations happening, but they're happening, and connections are being made, even ones that weren't already made, and we're lucky at how many already did exist. And so I understand completely how deeply painful it is for people to be told it's time to get a vaccine and not be able to find one, and how much everyone has given up in the last 11 months. It's been so painful, and we hear you, and we're working as hard as we can, and our legislative team is working as hard as we can, and we're operating in very constrained situations. So we need to hold hands and hang tough. You know, we're going to get through this.
That's beautiful. Tracy or Meredith?
I echo what Phoebe said. That was just beautiful. We together will come together. We're strong. We'll get on the other side of this. I promise. We just need a little more patience. Things are rolling out. Have faith in us. Have faith in the system. And Jo, I can't thank you enough from the bottom of my heart, your advocacy for us.
I'm glad to do it.
And I just want to give a shout out to all those local boards of health. Greenfield has been a terrific partner with us, and all of our smaller boards of health. This is unprecedented, and everybody's pulling together and working together. And it's just wonderful to see and great to be a part of, as much as I'd rather not be responding to a pandemic right now.
Well said, well said. And I love that you shouted out to the local boards of health. Let me just say, I believe Mayor Wiedegartner from Greenfield was on. I want to thank you, Mayor. Your the John Zahn site was celebrated, and it's exciting to know that that's going to be energized and reinvigorated for this next phase. Certainly, you know, David Narkowitz in Northampton, my mayor, I want to shout out, and then all of the town officials, in addition to the public health folks, the local boards of public health and the public health officials. Being a municipal official, being a school committee member, hardest job in the world. And then you put a pandemic and an economic crisis on top of it, harder still. So thank you, and we'll get through this together. Thank you so much, everybody. Take care.
Bye, everyone.
Bye.
Bye. Thank you.
Take care.